I think we are just starting, and let people join whenever they are ready. My name is Eszter Kismodi. I'm Chief Executive of Sexual and Reproductive Health Matters, and I really welcome everyone who is joining today, but also those who will watch this video later in order to get information about SRHM's latest call for papers on digital technology and sexual and reproductive health and rights. So we are organizing this, this session to provide information about the call for papers and also provide an opportunity to ask questions from the editors. So I warmly welcome today Emma Pitchforth, who is the executive editor of the SRHM Journal, and Nina Sun, who is the associated editor of the SRHM Journal and specifically involved in this journal issue. Hi, Emma, and hi, Nina, and thank you, Alex, for organizing the webinar. So I just would like to say a couple of words about SRHM, that is an international organization promoting sexual and reproductive health and rights globally. In the heart of our organization is the Sexual and Reproductive Health Matters Journal. And the organization was established in 1993. And since then, the organization is publishing the SRHM Journal. You may have known the journal before as Reproductive Health Matters or RHM. Due to digitalization, now we have three types of journal issues, and I focus on the journal here. We have an open issue when you can submit articles on an ongoing basis. There are special issues that are the product of special projects with collaborating partners on specific issues. And we have team issues that we run annually. And the theme issue for 2023 is digital technology and sexual and reproductive health and rights. And we recognize that there is a lot of publication and conversation about how digital technology is influencing positively sexual and reproductive health and provides opportunities for accessing services, information, and other products. There is a great improvement on various sexual and reproductive health technologies, like on sex tech or femtech, or various menstrual health applications that are really improving access to information and services. We have seen that during COVID, digital technology really facilitated the provision of services, including in relation to contraception, to the abortion pill and telemedicine. But we are also very aware that digital technology can also can have harmful effect. It can also lead to exclusion. In this issue, we are focusing on the rights-based perspectives of digital technology and sexual and reproductive health. And we invite papers that has a very specific analysis on the rights perspectives. And I would like to invite you, Nina, to say a couple of words what these rights perspectives may be.
Thanks, Eszter, and welcome to all the attendees for the webinar and the ones who are watching this in the future. So when we speak about sexual and reproductive health and rights and a rights-based perspective, we're really looking for papers that address how digital technologies uphold or are a risk to the intersection of health and human rights. And a logical place to start would be looking at the right to health. Under international human rights law, services and goods under the right to health have to be available. They have to be accessible, including affordability or economic accessibility and language accessibility. They have to be culturally acceptable and of high quality. So some papers that we may receive could look at how different types of technologies meet these standards or are at risk of falling short of these standards. In addition to that, I'll outline some paper topics that we would be particularly interested in terms of the submissions. So some of the papers can look at equality and non-discrimination considerations. So how do digital health technologies impact marginalized and structurally excluded populations? These populations can include adolescents, people with disabilities, migrant and refugee populations, people living with HIV, and other structurally excluded groups. Other papers could look at how digital technologies enhance or hinder other rights issues that are closely related to the right to health. So how do technologies impact privacy and confidentiality for the end users? How do they impact their safety and security? We're also interested in looking at analyses and good practices of effective and transparent governance and accountability mechanisms for technologies. So for instance, whether you're looking at a website, an application, or any other kind of technology, it will collect data on the end users. Who owns that data? Who can access that data? And who decides how that information is actually used? Closely related to this are also papers that look at the role of private entities when we talk about digital health technologies. So what's the interaction between public and private institutions and entities when we talk about the public health system and how it engages with digital health technologies? We're also interested in looking at papers that look at the use of sexual and reproductive health technologies in environments that are restrictive, either politically, socially, culturally, or legally. So for instance, in some settings, certain behaviors will be criminalized, certain behaviors and activities will be highly stigmatized. So how do these environments either enable or hinder the adoption of technologies for health? And finally, we'd be keen to look at good practices on the development of laws, policies, and practices and regulations, rather, on digital health technologies. So this could be in environments where there's a new law that addresses how digital health technology should be used, where there wasn't previously one existing, or the strengthening of the implementation of a specific law on these technologies. And finally, papers could look at different case studies on how digital health technologies have been used in organizing and advocacy for sexual and reproductive health and rights movements. Thanks, Eszter, back to you.
Thank you so much, Nina. So we can come back to you if the participants have any questions. So over to you, Emma, to give some guidance about how to submit papers and about the technicalities of the papers. What kind of papers are we expecting?
Thank you, Eszter. Yeah, I do have just a few slides so you can get familiar with some of the web pages and where some of the information is whilst you do it as well. So just share my screen. Is that sharing okay? Great. So as Eszter's covered really that we have different types of issues as a journal, and I've just highlighted the ones that we've had currently this year. So we run the open issue, and we've had two large themed issues as well, one on papers specifically around South Asia and one on self-care interventions and rights-based issues. So access. So that's been the focus this year, and similarly the call that we're talking about today will form the themed issue for next year. You can see we've Alex has already put it in the chat in terms of homepage and how to access information about the journal. We're a journal that's indexed as a lot of journals on the major places, PubMed Central, Medline, etc. And we work with a publishing partner, Taylor and Francis, in how we work. So what we're looking for across our issues really is to publish original, relevant and contemporary research that can help us inform, or others to inform, the development of policies, laws and services, really to fulfil the rights and meet the sexual and reproductive health needs of people. And that covers all ages, gender identities and sexual orientations. So we're really broad in what we try and look at in terms of sexual and reproductive health and rights. We similarly broad in terms of the disciplinary perspectives that we welcome as well. So we don't narrow down at all really in disciplinary perspectives. And we're always interested as well in methodologically innovative approaches. And as a journal, we're particularly keen to try and diversify the authorship base as well. So whilst we have papers from more traditional authors, perhaps in working in academia, we very much welcome papers from people working in advocacy, people working in frontline services and so on, and different partnerships of these types of authors. And we're happy to work closely with authors who perhaps have had less experience of academic publications before. I've just put some of the ways that Taylor and Francis think about our metrics, but also to give you an idea, if you're not familiar with the journal, in terms of the reach and access that people have to the journals. So it's an open access journal that's publicly available to anybody. We have over 1.5 million annual downloads of papers each year, and currently our impact factor is 5.7. So we've been on a growing trajectory in terms of our impact factor, number of downloads and the reach that the journal has. We also think about impact far more broadly. So in terms of SRHM, we're very much thinking about knowledge to action, and the wider organisation works on making those links between the evidence base and knowledge creation and change. But you can also explore the website to see, for example, some of the other impact that specific journal articles have had. So you can look at the most read, you can look at the most cited articles from across SRHM issues. And then you can, so there's one example here in terms of published last year in terms of having a high altmetric value, and you can explore through there what policies and so on have already picked up on these articles. And Alex today, who set up the call, also works very actively in terms of promoting journal articles. So if you publish with us, you have Taylor and Francis as a publishing house that will do promotion, but you also have SRHM that will promote your papers as well. So in terms of a digital technology issue, it's just to tell you where all the crucial information is when you need it. So the call for papers is available, and Alex has put it in the chat. This will link you through to full instructions for authors. This includes information such as article type, word length, how you structure your papers, and so on. And in terms of this issue, really we'd welcome original rights-based research articles, and that they might be from quantitative, qualitative and mixed methods research perspective. We also welcome different types of reviews, whether that's systematic reviews, scoping reviews, meta-analyses, different types of evidence syntheses. We would welcome analytic reviews, including that might be from a historical, policy or a legal perspective. And also we welcome commentary that might bring rights-based narratives, that might bring a propose a different way of looking at it, or something that we haven't or hasn't been considered in terms of thinking about digital technology and SRHR. So we really welcome those critical perspectives as well. So we have a broad range of article types that we can include and consider as part of the issue. You will see within the instructions there's guidance over authorship and criteria that must be met, and also we've introduced a new framework that encourages you to fully list how people have contributed to your paper and to report that transparently. In terms of, so we are an open access online journal, and that has article processing charges associated with it. We have a standard charge which is shown there in US dollars and UK pounds. There are a number of ways where you may have a discount to that, or you may be eligible for a waiver. So Taylor and Francis, based on World Bank classifications of countries, will offer 100% discount to people from low-income countries, and this is based on the corresponding author generally. And if you're in a lower middle-income country, then you have a 50% discount. As part of the themed issue, we can also use a limited number of additional waivers. So what we have asked you to do this time is to submit a request to the email address that's there by the 9th of December. And this is up to a maximum of 500 words, where we just ask you to outline why a waiver is required, as well as giving us a brief summary of your proposed papers. So we know that papers might not be written by that stage, but to give us an idea of what you're seeking to publish. And then there's an editorial committee will be established. So those requests are considered beyond the day-to-day editorial team that works on the journal. But then we would consider those quickly and be able to come back to you to let you know whether we can allocate you a waiver. The submission's all done through Editorial Manager, the online system, and there's a link again to it here. And the submission deadline we have for the call is the 15th of January in 2023. So that's the deadline. On submission, you will have the option to select that it's for a themed issue, and then you'll see digital technology as one of the options for themed issues. And we request that you do that. And if you also mention in your cover letter that it's for a themed issue, it just helps make sure that we know that that's where it's intended for. But beyond, we can take any questions today, beyond today, and as you're going through them, we're really happy to take any queries that you have. We're quite a small team, but if you email our editorial email, we'll be able to pick that up and try to get back to you as soon as we can. I think that's everything I wanted to cover. Thanks, Eszter. Stop sharing.
Thank you very much, Emma. So I'm coming to the participants that do you have any questions or comments, those who are joining this webinar? If you do have questions, then please raise your hand. In the meantime, we are also receiving questions via email. And one of the questions is to Nina that my original research proposal does not include rights-based perspective, but I think my analysis covers rights issues in relation to inequalities related to access, especially in relation to disability populations. How do I know that my paper is rights-based or not rights-based?
Thank you for that question, Eszter, and thank you to our email correspondent who sent us that question. So it's a good question. I think within the realm of public health, there's often a lot of talk about inequalities and equities, and oftentimes that language is more comfortable for people who are coming from a more traditional public health lens. I would say, I would encourage the author in that situation to take a look at their paper and see how much they can explicitly include a rights-based lens, because it's important to be able to integrate clearly a human rights perspective in the actual analysis itself. That being said, I think it really depends on the amount of the analysis when we talk about inequalities and inequities. You can address the, let's say, AAAQ framework of accessibility, availability, acceptability, and quality through an intensive inequity and rights-based analysis, as long as those elements are clearly stated in the paper in some way. So I think a lot of it will depend upon the information, the information included in the paper. And this is where having an abstract or sending some kind of information more in depth about what the manuscript covers would be extremely helpful for the editorial committee to assess how deep the analysis actually is. And so I would encourage the author, long story short, I would encourage the author to take another look to see whether they can explicitly integrate a rights-based analysis in terms of the language into their paper. But if they feel like they've done it sufficiently within an analysis of inequities and inequalities, then I would encourage them to submit and see what happens there. Thanks.
Thank you, Nina. And I'm sorry to the participants, but it seems that you cannot raise your hand and come into the discussion, but can you please post your question in the chat, and then we come back to you. Another question, Emma, to you, that what do I do if I am stuck in uploading my paper that happened before? So how people can get assistance in this regard? Would they need to go to Taylor and Francis, or would they need to come to SRHM? And the other question was about the word limit, that whether the 5,000 words is a strictly given word limit, or it can be interpreted more liberally towards the upper end of word limits. So I guess.
Yeah, so I'll take the word limit. So if you look on the instructions for authors, we provide a range for according to what paper type it is as well. And if you use those as a guidance, we do have some flexibility. So it's not a strict one. It's not like some journals where you'll automatically get it sent back because it's over the word limit. But I would keep in mind that you know, you want it to be readable as well. So, you know, it's thinking about whether you can say things more concisely, but we can work with you in terms of that as an editorial team as well. So there is some flexibility, but often papers that are much longer than the suggested word length end up being edited down. So, so I would use them closely as a guide. They're helpful, I think, in terms of what we're looking for. In terms of difficulties with submissions, there should be a way to raise a query with Taylor and Francis on the editorial manager system as you do it, but please use the editorial email as you're doing it. It should be straightforward and you shouldn't encounter problems, but please just flag with us through that email address if you are raising any problems. We've introduced a checklist which helps you see what we're expecting to be included in papers in terms of ethical approvals, information that's provided around ethical approval, information about funding and so on. So we've tried to be explicit in terms of everything that we would want to have included in a manuscript.
Thank you, Emma. I also would like to raise two questions that is always coming up when we are chatting in this editorial platform. One of them is about once papers are inquired to resubmit the paper. Very often the authors would like to chat with the editors or would like to ask questions. Is it a possibility if the comments are unclear or the process is not clear? Can the authors be in touch directly with the editors? And the other question, maybe for both of you, that what happens if the authors disagree with the editorial comments? That can happen based on facts or based on interpretations. So what the authors can do in situations when they don't really in agreement with the editorial comments and they can argue about their viewpoint.
Yep, so they are very welcome to contact the editors or editorial team, and that can be done by reply of email in terms of when they receive the reviews, or it can be done through the editorial email that we've provided. What tends to happen is when we provide reviews is that you will be supplied with comments and reviews from external reviewers, but you will also have reviews from the editor who's handed you a paper as well. And often it's a very good idea to look at that in addition to the individual reviews, because it will give you guidance on, you know, the editor often does some work in terms of clarifying what the reviewers are looking for and what you should be able to prioritise when you're making revisions. And yes, you can argue against the suggestions for improvements, and that's often done in conversations. So if they're fundamental, you can contact the editor to question that ahead of making your revisions. If not, you can make it when you're making the case, because we ask you to respond item by item when you've had reviewers' comments back, and it's for you to set out why you don't agree with those comments usually. Thank
you. Nina, do you have any comments?
Yeah, I'll just jump in off of what Emma said, and off of her last point, I would highly encourage all of the authors to really go through item by item in terms of, you know, when they receive a suggestion or a comment from either the reviewer or editor, to say whether they followed it or whether they agree or disagree with it. And particularly for the ones that they disagree with, it's a good way in terms of tracking what you've done, how you've responded to the comments, and then it's a good starting off point if you want to engage in discussions with the editors about, you know, why you disagree, you know, what you think should be done differently, you know, stating out the facts as the person, as you raised, Eszter. So I would highly encourage all authors to develop this tracking system when they respond to comments to both help track what they have done and use it as a starting point for engagement. Thanks.
Thank you very much. Do you have, I don't see any questions. Do you see any questions in the chat? I'm not sure that I see any questions. Do you have any final comments, Emma or Nina, before closing this session?
No, I don't think so. Just that if anything isn't clear when people are going through instructions, then do contact us and we'll try and get back as quickly as we can.
Nina?
No specific overarching comments or questions, but more just a statement of excitement. It's really exciting to be able to support this issue on digital health technologies for sexual and reproductive health and reproductive justice, just given what's gone on in the last couple of years and what's currently ongoing on these issues. So we look forward to receiving all of your manuscripts.
Thank you so much for all your participation, and thank you very much for watching this video later. We are available for your questions and inquiries, and we really encourage you to submit a paper, and looking forward to read the knowledge that you would like to communicate through us, and really looking forward. Thank you so much for your attention, and thank you for the participants and Alex for managing this webinar. Have a nice day, good evening, and good morning, those who are joining from different parts of the world. Bye-bye.